this video now we are going to start the front of the leg and also the dorsum of the foot. So here mainly we are going to discuss about the superficial fascia of the leg and the deep fascia of the leg. So in the superficial fascia of the leg, mainly in the front of the leg and also in the dorsum of the foot, as you can see in this diagram, this is the front of the leg and this is the dorsum of the foot. So mainly these structures are having superficial veins. So this diagram shows the superficial veins of front of leg, and also there are cutaneous nerves. This diagram you can see, this is showing the cutaneous nerves of front of leg and also the dorsum of the foot. And we are also discussing about lymphatics, small unnamed arteries. So many things we're going to cover today in this video. So first let's start with superficial veins. So just remember that the superficial fascia of the leg and the dorsum of the foot contains first the veins, superficial veins, and of course the cutaneous nerves and also lymphatics. So let us start with superficial veins. If you see mainly the dorsal venous arch, this is called as dorsal venous arch, which is present on the dorsum of the foot. So this is lying on dorsum of foot, especially over the proximal parts of metatarsal bones. So here will be the metatarsal bones, right? So just above, proximal to the metatarsal bones, you will find the dorsal venous arch. And this receives mainly 4 dorsal metatarsal veins. So you can see these are the 4 dorsal metatarsal veins which are coming from the fingers. So 1, 2, 3, 4. So these 4 dorsal metatarsal veins will go into the dorsal venous arch, and mainly each of which is formed by union of 2 dorsal digital veins. So if you see, in turn this dorsal metatarsal veins are coming from 2 dorsal digital veins. So in the name itself you can find out dorsal digital veins means on the dorsum of the foot the digits have veins. So that digit veins means the finger veins are together forming metatarsal veins, and these metatarsal veins they come into the dorsal venous arch. So next what happens? There is a origin of great saphenous vein. If you see, especially on the medial side of your leg, there is a great saphenous vein. Okay, so this is great, also called as long saphenous vein, which is formed by union of medial end of dorsal venous arch with the medial marginal vein. So this is also called medial marginal vein, and this is called lateral marginal vein. As they are present in margins of the foot, they are called as marginal veins. So remember, first you have the dorsal digital veins. After dorsal digital vein, you have dorsal metatarsal vein. After dorsal metatarsal vein, remember the marginal veins. You have medial marginal vein, lateral marginal vein. So actually, these all veins are draining into our dorsal venous arch. So from this dorsal venous arch, if you move further on the medial side, you can check the great saphenous vein. So now it passes upwards in front of medial meiosis. The important thing to remember about great saphenous vein, it always passes in front of medial meiosis. Okay, so it is passing in front of medial. You can see this is the medial meiosis. So it will pass upwards in front of medial meiosis, crosses the lower 1/3 of medial surface of tibia obliquely, and runs along medial border to reach the back of the knee. So finally it will reach back of the knee, that is nothing but the popliteal fossa. So the saphenous nerve always run in front of the great saphenous vein. So this is the great saphenous vein. So in front of this there is actually one nerve that is called as saphenous nerve. If you remember, the saphenous nerve is actually it is coming from the posterior division of femoral nerve. Okay, so we know already femoral nerve divided into anterior division, posterior division. Especially its posterior division is giving formation to our saphenous nerve, and that saphenous nerve is on medial side, and that too it is in front, or you can say it is just anterior to the great saphenous vein. So this is about the medial side of the leg and dorsum of foot. Now let us discuss about small or short saphenous vein. So the small or short saphenous vein is formed mainly by union of lateral end of dorsal venous arch with the lateral marginal vein. So you can see this is the lateral marginal vein, and this is the lateral side of the dorsal venous arch. So this both unite together and they continue in turn as a small saphenous vein on the lateral side. So on the medial side we saw a great saphenous vein. So on lateral side we are checking our small saphenous vein. So Now actually this all veins which are here, they drain into this lateral side of little toe. So mainly they drain into the lateral side of little toe. Of course, on medial side you have the big toe. Here you can see on medial side you have the big toe, on the lateral side you have little toe. So all the little toe will come and drain into the small saphenous vein. And remember that this small saphenous vein is passing upwards and behind the lateral meiosis. So you can say this is the lateral meiosis, so it is passing behind it, whereas great saphenous vein moves in front of medial meiosis. Okay, so small saphenous vein moves backward or behind the lateral meiosis to reach the back of the leg. So the sural nerve accompanies the small saphenous vein. So remember the nerves which are with these veins, that is also important. In the case of great saphenous vein, there is our saphenous nerve, which is of course a part of posterior part of femoral nerve. And if you see the small saphenous vein, it is accompanying the sural nerve. So sural nerve is along with the small saphenous vein on the lateral side of the leg, okay, and also lateral side of the foot. So now we'll discuss about this lateral meiosis. Okay, this is done. A sural nerve is accompanying small saphenous vein. So actually this both saphenous veins are also connected to the deep veins through perforating veins. So actually this both saphenous veins, that is a great saphenous vein on the medial side and small saphenous vein on lateral side, they both are also connected with each other, mainly to deep veins. So both saphenous veins are connecting to the deep veins. So they are connecting to the deep veins by the help of perforating veins. So there will be some perforating veins between the small saphenous vein and great saphenous vein. So by means of this perforating veins, they are connected to the deep veins. So this is about the superficial veins. Now let us discuss about the cutaneous nerves. So now let us discuss about the cutaneous nerves. So first one is the infrapatellar nerve. It is actually, according to the name, you can see infrapatellar means just below the patella you have a nerve called as infrapatellar nerve. Of course, it is a branch of saphenous nerve which mainly pierces the sartorius muscle and deep fascia, especially on medial side of knee, and it is curving downwards, forwards, and supply the skin over the ligamentum patellae. So actually this nerve is called infrapatellar nerve. It supplies ligamentum patellae and it is passing through sartorius muscle on the medial side of the knee, and it is mainly supplying the skin over the ligamentum patellae. So this is a branch of saphenous nerve. Okay, so done about infrapatellar nerve. The next nerve here is the saphenous nerve. If you already know, saphenous nerve is a branch of posterior division of femoral nerve. It pierces the deep fascia on medial side of the knee between the sartorius and gracilis muscle, okay, and runs downward in front of great saphenous vein, and it supplies the skin of medial side of leg and also the medial border of foot up to the ball of great toe. So first now we discuss cutaneous nerve is infrapatellar nerve, which is supplying the ligamentum patellae and the skin below the patella. Next nerve is saphenous nerve. It is supplying the medial side of the leg and also the medial side of the dorsum of foot. But remember that this saphenous nerve is just in front of the our great saphenous vein, right? So just it is in front of great saphenous vein, and it is mainly coming from posterior division of femoral nerve, and it is also supplying up to the ball of great toe. Okay, so this is about the second nerve. Next we'll discuss about the another nerve that is the lateral cutaneous nerve of calf. So till now we completed on medial side. Now we'll move on to lateral side. On lateral side you have lateral cutaneous nerve of calf, which is a branch of common peroneal nerve. If you know a sciatic nerve in the popliteal fossa, it will divide into tibial nerve and common peroneal nerve. So that common peroneal nerve gives a branch that is lateral cutaneous nerve of calf. Actually it is piercing the deep fascia over the lateral head of gastrocnemius muscle, and it is descending to supply the skin over the upper 2/3 of lateral side of the leg here. So this is supplying upper 2/3 of lateral surface of the leg. Next, coming to the superficial peroneal nerve. So superficial peroneal nerve is a branch of common peroneal nerve, arise on the lateral side of the neck of fibula deep to fibers of peroneus longus. It descends between the peroneal muscles and pierces the deep fascia on junction of upper two-thirds and lower one-third of lateral side of leg and divides into the medial and lateral branches. So this superficial peroneal nerve is in turn divided into the superficial yeah, it is divided into the medial and lateral branches. You can see this is the medial branch and this is the lateral branch. This is a superficial peroneal nerve. So if you remember, the two sides of lateral side are supplied by lateral cutaneous nerve of calf, superficial peroneal nerve. These both are branches of common peroneal nerve. Whereas if you see this infrapatellar nerve, it is infrapatellar nerve is actually branch of saphenous nerve, means nothing but it is also coming from the our femoral nerve. Even saphenous nerve is coming from femoral nerve. So medial side of the leg are branches of femoral nerve and lateral side of the leg are branches of common peroneal nerve. Okay, so the superficial peroneal nerve will in turn divide into medial branch and lateral branch, that we need to remember. So mainly these branches of this superficial peroneal nerve supply the skin over lower third of lateral side of leg and also skin over entire dorsum of foot, with exception of there are some exceptions. Let us see what are those exceptions. There is a lateral border supplied by sural nerve. If you see this lateral border of the dorsum of leg, this is supplied by sural nerve, but it is not supplied by superficial peroneal nerve, so that is the exception. All the lateral side of the leg is supplied by superficial peroneal nerve, and even almost all of the part of the dorsum of the foot is supplied by superficial peroneal nerve, but the lateral most part of the leg on the dorsum is supplied by the sural nerve. So this is one exception. The next exception is the medial border of base of great toe. If you see, this is the great toe, sorry, here. So I'm saying that the superficial peroneal nerve supplies lateral part and also this dorsal part. Only lateralmost part is supplied by sural nerve. And if you see, this is the great toe on the medial side is supplied by deep peroneal nerve. Okay, this is also exception because superficial peroneal nerve only supplies this area. It will not supply the medial border of the great toe. It is mainly supplied by the deep peroneal nerve. So this is a second exception. And next exception is the cleft between the first and second toes is supplied by deep peroneal nerve. This is one more exception. So medial border up to the base of great toe is supplied by saphenous nerve. We know already saphenous nerve supplies this, and this gap is supplied by deep peroneal nerve and it is not supplied by the superficial peroneal nerve. Next, coming to the sural nerve. The sural nerve is a branch of tibial nerve. So already you know tibial nerve gives a sural nerve branch and it arises in the middle of popliteal fossa. It runs vertically downwards, pierces a deep fascia in middle of back of leg and accompanies the small saphenous vein and supplies the skin over the lower half of back of leg. So lower half of back of leg also supplied by sural nerve and of a whole of lateral border of foot up to the tip of the little toe. So this all lateral side and also posterior side lateral side is supplied by sural nerve, which is a branch of tibial nerve. So let us once revise what are the different branches of this nerve at the last. So next we'll discuss about deep peroneal nerve. It is terminating mainly by supplying skin adjoining the cleft between the first and second toe. So between the first toe is great toe, second toe is this one. So between the two toes there is a gap and that gap is supplied by deep peroneal nerve. Okay, and next there is a digital branch of medial and lateral plantar nerves. So you can see the digital branches of plantar nerves. According to name, you can see digital means they'll supply the digits. So actually it is of medial and lateral side, so it curve upwards, supply the distal parts of dorsum of foot. So this distal parts of dorsum of foot are supplied by this digital branches of plantar nerve. So once again let us revise all the cutaneous nerve. So by this we completed superficial fascia. So in superficial fascia, once again if you summarize all the points, it is very simple. So in superficial fascia you mainly have the cutaneous nerves and you have the superficial veins. So superficial veins, nothing but first you have the digital veins. Digital veins join together to form the metatarsal veins. Metatarsal veins will and remember metatarsal vein, and on side you will have the marginal veins. One is the medial marginal vein, one is the lateral marginal vein. So all these veins will go and drain into dorsal venous arch. So from the dorsal venous arch on the medial side they will continue as great saphenous vein, and it is accompanied by saphenous nerve, whereas on the lateral side they continue as small saphenous vein, and lateral side it is accompanied by the sural nerve. That's it. So this is a quick review of the superficial veins of front of leg. Now let us understand the quick review of cutaneous nerves of front of leg. If you see, first we'll start from the medial side. On the medial side, all of leg and also dorsum of foot, everything is supplied by our femoral nerve. The femoral nerve branches only supplied. So there are two branches, especially here you have infrapatellar nerve, which is a branch of femoral nerve, and also actually it is a branch of saphenous nerve. Of course indirectly it's a branch of femoral nerve. And next you have saphenous nerve. It is coming from posterior division of femoral nerve. So this is all supplying mainly the medial side of the leg and also the medial side of the great toe. Okay, so next coming to the lateral side. So moving on to lateral side, you have lateral cutaneous nerve of calf, and also you have the superficial peroneal nerve. Okay, so this lateral cutaneous nerve of calf is coming from the common peroneal nerve, and this superficial peroneal nerve is also coming from the common peroneal nerve. So this common peroneal nerve are indirectly supplying the lateral side of the leg and also dorsum of the foot. But there are exceptions in the, especially the dorsum of the foot, that the dorsum of the foot, or especially on the lateral most side, is supplied by the sural nerve, and this sural nerve is in turn a branch of the tibial nerve. Okay, and next coming to the deep peroneal nerve. The deep peroneal nerve will supply the cleft between the big toe and the second toe. Okay, and you have the digital branches of plantar nerves which mainly supply the digits, that is the digits of the leg. So especially distal part of digits of the leg on dorsum of leg. So this is all about the superficial veins and cutaneous nerves. So by this we completed our superficial fascia. In next video we'll discuss about the deep fascia of leg.